Okay, so before entering the room, I would check my client's charts, I would check the orders, and I would gather all my supplies, which I have right here. And then I would knock on the door. I'll enter the room. Hi, I'm Alexis. I'll be your student nurse. Can I have your name and date of birth? I'll check the wristband.
Mackenzie Gore, 0214 2003.
Okay, and they match. So I'll do hand hygiene, and I'm just going to do a head-to-toe assessment on you today. Do you know what that is? Do you have any questions?
No, I've had them before.
Okay, and so then I would raise the bed up if needed, which right now I don't need to, and then I would, and then I would ask, are you in any pain?
No.
Okay, so I'm gonna ask you a few questions. What is your name?
Mackenzie Gore.
Where are you?
My house?
The hospital.
The hospital. Sorry.
Why are you here?
For like a physical.
Okay, and what year is it?
2026.
Okay, so those are all correct. And then I would begin to take vital signs. So I will take her blood pressure. Okay, it is 118/78. And then I will check her pulse for a full minute. Okay, it's 82. And then I'll take her temperature. I'd put a thermometer in the mouth. So her temperature is good. It's 98.6. And then I'll put a pulse ox on, check her oxygen, and it is 99. And then I count her respirations for a full minute. Okay, respirations are 18. They're also unlabored. Rate and rhythm is regular. No shortness of breath, no coughing, no sputum. Are you a smoker?
Yes.
How long have you been smoking for?
A year.
Okay. So that'll be something to look out for when I listen to her lung sounds. So then I would ask her to get up. I would check her height. I would check her weight, but for the purpose of this, I don't have a scale or anything to measure height with. So we'll just say she's 120 and 5'4". And while I'm doing that, I would also assess her gait. Gait is steady. I would also, while I'm asking her all these questions, assess her mood and affect, and it's pleasant and cooperative. And then I will begin with looking at her scalp. So I'll take my pen light and I would just go through her hair. I'm checking for redness, dandruff, cleanliness, any lesions, make sure there's equal hair distribution, and there is. Obviously I would have on gloves, and then I would palpate. I'm feeling for symmetry, lumps, bumps, anything like that, which there is none. And then I am going to check her eyebrows, I'll begin with. So eyebrows, no redness, equal hair distribution, no swelling, no lesions. And then I'll check the eyelids. There's no, can you close your eyes for me? There's no redness, no swelling, no lesions. And then can you open your eyes? I'm checking the eyelashes. There's equal hair distribution, no drainage, no swelling on the lash line. And then I would take my pen light, wherever it is, somewhere. So, oh, it's right here. And I'll check her pupils. Stare forward. I'll check her pupils. I would make sure that they are round, reactive to light, accommodating to light, and that they are equal. And then I'll check her sclera. I'll make sure that it's clear, white, no drainage, no redness, no yellow, nothing like that. And then I'll pull back and I'll look at her conjunctiva, and it is pink, moist, no lesions, no swelling, no drainage. And then I will, okay, so I'm gonna put my fingers behind your head, and let me know when you can see my fingers, okay?
Here.
Okay, perfect. And then I'm going to have her follow my pen light, 6 cardinal fields of gaze. So follow with your eyes, not your head. Okay, and then I will look at her nose from the outside, make sure that there's no swelling, redness, lesions. Her septum is midline and it is symmetrical. And then I would have you look up. I'll look inside the nose, make sure there's no lesions, drainage, that's abnormal for the nose. So it's normal, pink and moist, no swelling. And then I will take my fake cotton ball, and so I want you to close your eyes, and I'm going to touch your face on both sides. Let me know when you feel it.
No, I felt it, yeah.
Okay, close your eyes.
Felt.
Okay. And then I'm going to have you raise your eyebrows, okay? And then smile, and then frown. Frown, good.
Oh. Sorry.
Okay, so it's symmetrical, and then I'll check her mouth. So I'll look at the outside, her lips, no lesions, no drainage, no swelling. They're pink and dry, and they're filled. And then I'll have you open your mouth, please. So I'll have you say ah. I would put in my tongue blade and use my pen light, and I'll shine in the back. I'll check her tonsils. There's no drainage, redness, swelling. They're pink, they're moist. I'll open your mouth. I'll look at the uvula. It's midline. I'll check her gag reflex. I'll check the tongue. It's pink, moist, no lesions, no swelling, midline. I'll check the gums. Pink, moist, no lesions, no swelling, no drainage. And then I'll check the teeth. Do you wear dentures?
No.
Okay, so there's no dental caries. They look well taken care of. I also wanted to ask if you wear glasses or contacts.
I do not.
Okay. And then I will also ask you to remember a word for me. So the word's going to be red dog. Okay. So while I finish doing that, I'm going to move on to the ears. I'll look inside the ears. I'll make sure that there's no lesions, drainage, and then I will palpate the ears, make sure there's no swelling, tenderness, and then I will check your hearing on both sides. So I'm going to whisper a word in your ear. Tell me out loud what I said.
Fred? Fred.
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 Okay.
Blue.
Okay. So then I'm going to have you push against my hand. Okay. Okay. And then I'm going to check the neck. I'm going to check that. I'm going to check that it's midline. There's no swelling. There's no drainage. I'm going to palpate. There's no swelling. There's no lumps. There's no bumps. Can you turn your head to the side, please? Okay, and the other way. JVD, not present. And then I am going to have you push up on my hands, your shoulders. Good. Okay, so I'm going to assess her chest while I'm here. It is even. It is rising and falling symmetrically.
Whoa.
And then I'll check her upper extremities, and I'll check that her color is appropriate for ethnicity. I'm gonna check for lines, anything like that. There is none, there's no bruising, there's no cuts. I'm gonna check her hands. I'm gonna make sure that the color here is appropriate. I'm gonna have, can I have your other hand? I'm gonna check her fingernails for clubbing. There's no clubbing, there's no cyanosis. I'm gonna feel her pulses 1 minute bilaterally. And they're strong and they are equal. And then I'm gonna check her capillary refill. It's under 2 seconds. Okay, and then I want you to stick your arms straight out, push down. Okay, now flip your hands, push up. Okay, good. So while I'm by her chest, I'm going to listen to her lung sounds. Take deep breaths. Okay, so I'd go all the way down, and then I would do the back as well. And once I do the whole thing, they are clear bilaterally. And then I'm going to listen to her heart. Okay, aortic, pulmonic, herbs, tricuspid, mitral. And then I'm gonna listen to her apical pulse for a full minute. And it's 80 and it is strong. S1 and S2 osculated, no murmurs, no gallops. And then I'm gonna have you lay down for me, please. Okay, I'm gonna move your blanket down. And have you had any nausea, vomiting, tenderness in your abdomen, anything like that?
No.
Okay. So first I'm gonna look at her stomach. It's not distended. There's no discoloration. There's no drains, lines. So I'm gonna listen for a full minute in each quadrant to all her bowel sounds. So I'll listen. And then once I do that, they're normal active. And I'm gonna palpate. Let me know if you feel any tenderness. Okay, so no tenderness. So while I'm here, I'm gonna check your lower extremities as well. I'm gonna check once again, skin, color is appropriate to ethnicity, no lesions, no redness, and then I'm gonna check for edema. There's no edema present. And then I'm gonna feel her pedal pulses bilaterally for a full minute. They're strong, +2, equal. And then I'm gonna check her capillary refill. It's less than 2 seconds. I'm gonna bring your knees to your chest. Okay. And then I'm gonna have you push up. Okay, pull down, pull back on your feet, and push against. Okay, so that's strong. Okay, we are all finished. You can sit up for me, please. Do you have any questions, concerns? Okay, well, do you remember the word that I told you at the beginning?
Yeah. Red barn.
Okay.
Wait, red dog?
Yes,
Okay.
okay. So then I'm going to do hand hygiene again. I'm gonna do all my safety things. Lower the bed, lock the bed, handrails. Here's your call light. And then I would hand hygiene again, and I would document everything, and I would obviously provide privacy and all the things. Okay.